A very good morning to you. I'm Howard Feldman. This is the Sunday Synthesis podcast with me, Howard Feldman, and Dr. Anton Meyberg. Dr. Meyberg should not be working today, and yet we are talking to him from the hospital. We'll need to find out a little bit more about that. Before we begin, I do want to make the following observation and the following, it's not really a statement, but I guess maybe it is. This podcast is recorded every Sunday, as we have done since March 2020, and we do so on the basis of the knowledge that is available to us. We are not political. I'm not political. Dr. Anton Meyberg is not political. The advice that we give, or the advice rather that Anton Meyberg gives, is based on his medical experience on the basis of information that he's seen coming his way and that he is reading. We are not affiliated with any government organization, which is why we can comment on things around vaccines without fear of needing to toe any party political line. On that basis, I say good morning. Dr. Anton Meyberg, why are you talking to us from the hospital? You are not meant to be on call today. And why do you look like that?
So I look like that because this is the state of the nation at the moment. If I was the president, I would be standing up and giving you the state of the nation, which wouldn't be a exciting state of the nation. Unfortunately, I am at work today because the numbers are ever increasing. The numbers in our hospital, we've got over 160 COVID positive patients. We've got over 40 patients in ICU with over 27 ventilated. The numbers are absolutely insane. We are having multiple deaths a day. We're having multiple admissions a day. We're having anything from 20 to 30 admissions a day. Patients are just being swarmed in. Patients are being swarmed out when possible, but we just can't keep up with the numbers. And at this point in time, it's every doctor trying to help each other because we cannot manage with the numbers. And normally the way it works is we've got 2 people on for the weekend to cover the hospital. Those 2 people cannot manage the numbers. So right now we've got 5 doctors on for the weekend to try and help with the onslaught. And I must say that we're in a very privileged position because a lot of the doctors have now stepped up to the plate. A lot of the neurologists, cardiologists, general surgeons, plastic surgeons, even some of the GPs are helping us in phoning patients and helping give information to families. So we're very blessed that way because people are actually really helping us out. And It's what we need at the moment. It's a devastating situation. I can't actually begin to start saying how bad it really is. And I don't think people can understand how bad it is.
Well, I just want to stop you. I want to stop you there because for a layperson like myself, when you say multiple deaths, for example, every day, I'm assuming that that's happening at a hospital anyway. And I know that you have to be very careful about the numbers that you disclose in terms of confidentiality and that type of thing. But give me a sense of what that means. Because I hear the word multiple deaths and it goes over my head. And if it goes over my head, it's doing that for everybody else as well.
Right. So generally, we can say that at a hospital, it's an average. You say there'll be 2 or 3 deaths a day in a general day at a hospital, which is quite understandable. You've got sick people. At some days, we can be looking at anything from 10 to 14 deaths a day. Most of the days, we're looking at about 6 deaths a day, and that's the norm. And it's not only our hospital; it's every single hospital throughout Gauteng I'm talking about. Every single hospital is basically just going through this wrath of deaths and wrath of critically ill patients. So the numbers are actually just going up and up. And even if you look at the Gewe Kadisha website, if you look at the number of deaths, and there are 8 deaths today on a Sunday. There were 7 funerals on Friday, 6 or 7 on Thursday. The numbers are just going up and up and up. And it's just devastating what's going on.
And this is happening in every single community, especially across Gauteng at the moment.
Yeah, I think so. And I think let's just get to the numbers now just to explain it a bit better. But we're currently sitting on 184 million cases worldwide, with 3.98 million deaths, 168 million cases resolved. United States is 34.5 million cases with 621,000 deaths. India, 30.5 million cases with 402,000 deaths. And South Africa has 2,042,311 cases with 61,507 deaths, which are definitely being underreported. As well as there are now 26,485 new cases in the last 24 hours, of which 16,091 of those cases are new positive cases in Gauteng. And the overall test positivity rate of that 26,000 is 27.3%, positive. So the people that tested, 27% of those people are positive. The cases in Gauteng hospitals, there's 7,852 patients in hospital being treated for COVID, of which 1,366 are in ICU and 739 of them are ventilated. The numbers are mind-blowing. It's overwhelming, and we are in a state of actually anarchy, chaos.
I mean, I can't ask how you cope with this, because I guess you don't. You put one foot in front of the other and you just continue.
The coping mechanisms are not for now. The coping mechanisms are maybe for a later stage. Right now, we've got to put our head down, as you say, and just do. We don't have time to realize actually how bad it is, although we're understanding it's terrible and shocking, but we actually don't have time to conceptualize what we're going through and what it's doing to us and what it's doing to patients and what it's doing to families. And the amount of abuse we as doctors and nurses and physios are taking from patients' families because they're not getting feedback where we try and give feedback, it's not our fault. We can only do what we can do. We try to put mechanisms in place. We try to keep in contact with families as much as possible. But at the end of the day, we're also human beings.
Tell me again, how many cases at your particular hospital?
Over 160 cases at the hospital, of over 40 in ICU, 27 ventilated at present. I'm sure that number will go up a bit later. It's, also got a limited amount of ventilators.
Well, I wanted to ask you about that. How are you even making these decisions? Are you playing God?
So we are playing God, and we're not meaning to play God, but we don't have a choice. And it's unfortunate, but unfortunately, as they did in Italy and as they did in Spain, the extremely frail and elderly people who are over a certain age are not made first criteria for a ventilator. Some of the major comorbidities over somebody who's 45 years old is put through an ethics committee, and it's decided that which patient should be getting the ventilator first. And we never ever thought we'd be in this situation. And it's almost, we thought that would be a sort of a downward trend of this peak going down, and it's not going down. It's going up, up, up. So we haven't plateaued. We haven't hit a downward trend in the peak, and it's only getting worse.
So just to explain that, so there's the hospital, does each hospital have its own ethics committee that makes these decisions?
So each hospital has its own ethics committee that decides, if a patient needs to go on a ventilator or should go on a ventilator, or if there's two patients at the same time, there's only one ventilator left, the ethics committee makes that decision to decide who gets the ventilator. So it's not playing God. It's past that stage. We can't play God. We aren't God. We aren't the decision makers as that. The ethics committee makes a decision on the best person who would please God get through this over and above what there is. And that's the reality of what we're dealing with. It's a cruel, harsh, terrible thing. And it's harder for us as doctors when we have to watch this and we have to say to somebody that you can't get a ventilator because it's going to somebody else. But that's it. That's the reality.
I actually have no idea how to I can't respond to that. All I can say is just hang in there. What does bother me is the comments around the abuse from families. I mean, I get it, because they can't talk to the person, they can't come and visit the person. Therefore, the doctors are really the only contact in some cases that they'll have with a patient, which obviously makes them very anxious. But at the same time, you're one person with 24 hours in a day.
Look, the hospitals are trying as well. They're trying to get set up social workers to phone people. And as I say, we're getting some of our colleagues to phone families. We're doing it in critical cases. We're speaking to families. But people have got to understand, you cannot speak to everybody every single day. Otherwise, you won't have time to work.
I do get that. Would you like more doctors to step up? If someone's watching and they are a GP, they are a qualified specialist in some area, even if they're not a pulmonologist.
Look, with all due respect, I think the GPs have got their hands full. They're doing a sterling job. I mean, we're so blessed to have the GPs in our community at the moment, because they're taking a huge load off us by managing patients at home that shouldn't be at home, that should actually be in hospital. So I don't know how much more they can step up either. There's also a limit for people, and they're also in a terrible quandary, because they're also treating people that they know shouldn't be at home.
They shouldn't be treating.
Not enough hospital beds, and they've also got to make decisions like that. So got to take off my hat to them as well, because they're playing their role more than ever.
All right. So that's That's where that is at. Right, let's just talk about some of the details. And thank you, everybody. I mean, last week we had more than 24,000 people watching this podcast. We've been inundated with questions. A lot of them can be grouped, as I always try and do. And I'm hoping that we'll cover as many of them as we possibly can. Let's just talk where we are. You thought that in terms of the Delta variant, you thought that we would have peaked by now, or at least plateaued by now. Give us your sense of what is really going on out there.
So I'm speaking to all my colleagues from different hospitals. Everyone's in the same situation. The numbers are exorbitant. No one is peaking, no one is plateauing. In fact, last week on, I think Wednesday night, our hospital went into divert because we had no beds. We had not enough oxygen because we didn't have beds left. So we had to divert, and that's a terrible situation when you've got to take people who are critically ill and move them from your hospital to try and find a bed somewhere in Gauteng or in another province. Mm-hmm. And that's this Delta variant, which is highly, highly transmissible, much more infectious. And even though the studies aren't out, that they aren't confirming it, it's definitely far more severe than the Alpha and Beta variant. And it's almost like it's sort of jumped on the Beta variant and sort of supercharged it. And made it quadruple as bad as it was when we had it.
So what you're seeing is that it is more aggressive in terms of symptoms.
Far worse. During the second wave, people were sick and, a lot were in ICU. But what we're seeing now is people whose bloods don't correlate with what they should be seeing. A lot more people in what we call multi-organ failure, where the body shuts down, the kidneys aren't working, their hearts aren't working, together with their lungs that aren't working. So these people are critically, critically ill.
Wow. I feel like I'm going to go for a test straight after this. Feeling very, very anxious right now. Tell us in terms of the vaccine efficacy from the Johnson & Johnson and the Pfizer, the two vaccines we've had in this country. Are you seeing breakthroughs? If you are seeing breakthroughs on either of those, how severe are those cases?
Look, we are seeing breakthroughs, and we've always stated that no vaccine is 100% foolproof. The point of the vaccine, and once again, I'm doing this, I always regurgitate this. We go back to the flu vaccine, that if you've had the flu vaccine, it doesn't mean you can't get flu. It just means you don't get it as severely. So yes, we are seeing breakthroughs from the Johnson & Johnson vaccine, but the breakthroughs are very mild. And it's not in a large amount of people. So you do hear of people getting sort of infected, but the majority of people, and I'm saying more than 98% of people I've heard of, have got very mild disease and are carrying on with their jobs. Some of my colleagues have got their breakthrough infections now, and they're not exceptionally sick. They're unwell, they've got fatigue, they've got a bit of myalgia, they're coughing a bit, but they're not critically ill. They don't need hospitalization. They don't need major medication. So it's definitely working. The Johnson & Johnson is definitely looking to be a successful vaccination. In fact, the company came out with a statement this week that it's saying it is effective against the Delta variant. Let's see. I'd like to see it in an independent sort of company proving that as well. But from what we're seeing, there's definitely a very good reaction to people who are getting vaccinated with the Johnson & Johnson.
Pfizer as well? Or is it still too early in terms of, okay, but what you're seeing is good.
We think the Pfizer, the two sort of vaccines, the two Pfizer vaccines, definitely making a huge difference.
And a lot of people have asked about, especially from in terms of medical frontline medical workers, if they've had the Johnson & Johnson, would you recommend, if they can, getting the Pfizer booster?
Look, I've always said this, and if you're a frontline worker, you've got more than yourself to think about. You've also got your family to think about. You're going home to your partner, to your children, to maybe your parents, etc. So you've got a huge responsibility, and you're in the COVID ward basically all day. You're exposed to it, and either you can believe the Johnson & Johnson statement that you don't need a booster, or you can say that you would like a Pfizer booster because you're going to increase immunogenicity and the working of the actual vaccination. I would believe that, to me, having a Pfizer would be the best idea. But I'm saying this not as a blanket statement that everyone must go out now and have a Pfizer booster. I'm saying this we're in a state of quandary. We're not vaccinating enough people. Now, if everyone who's had a Johnson & Johnson runs out to try and get a Pfizer vaccine, what about the people who haven't been vaccinated? So this is going back to ethics. You've got to allow people who haven't been vaccinated to be vaccinated first. It would be nice and ideal to get a Pfizer if you're a frontline worker, but also you've got to just hold back and see what you can do.
Right. Okay. And very interesting that SAPRA yesterday came out with a statement that they are approving the Chinese vaccine. I can't remember exactly which one it is, and that in fact 5 million will arrive before the end of July. What's your feeling on that? Would you recommend that people get it?
I think this is going to get me into serious trouble with certain people, but as you said at the beginning, we're an apolitical organization, and
we're not even an organization.
Aren't we CCPTY Ltd, or isn't that what we are?
Yeah, I don't think so. But, I just think we're two guys trying to give as much information to people as possible, information they might like or not like. We haven't even got to ivermectin yet.
Yeah. Well, look, I mean, the point is we're in dire straits. We're in such we're such cuck in this country. I mean, what do we do? What do we actually do? So either we can say, don't get vaccinated, or do get vaccinated. Now, first prize is to get vaccinated. That being said, the Sinovac is the Chinese vaccine. There's two. There's the Sinopharm and the Sinovac. The Sinovac is one of the inactivated vaccines that is used. But look at what happened in the Seychelles, where most of the Seychelles were vaccinated with the Sinovac, and yet they're all having breakthrough infections and things. And we haven't actually seen enough data to say, is the Sinovac effective enough against the Delta variant? So I do believe you definitely get some benefit from taking the Sinovac, maybe 51% against mild to moderate thing, and hopefully it will protect you against hospitalization in severe cases. But personally, and I'm saying personally, I'm not saying what other people should do. Personally, if I had the choice, it was my family, I'd prefer to go for the Johnson & Johnson and the Pfizer.
Okay. So you've said it as gently as you possibly can, but you are saying that from the data that you have seen, you are not that...
From the data that I haven't seen, that's the point. We haven't seen the data to show us that it's effective against the Delta, etc. And as I say, a few weeks ago, it wasn't okay, and now it is okay. And is that a buckling to political pressure? Is that buckling to party pressure? Who knows?
And of course, the problem there is that in terms of the way it's structured, we don't really have a choice. If you go to a vaccination site, and they're using a particular vaccine, that's what you're going to get. Obviously, it's our choice. And certainly if
Look, we've always said that if you get a vaccination, just take the vaccination, because you don't know. I mean, had we hindsight,
do you feel that about this vaccine?
Well, look, let's take it back a step. Had we have hindsight, and in February, had we known what we know now about AstraZeneca, that would have held true. But we didn't know then what we know now.
Well,
it's a very different situation. We didn't know. We had no idea that the AstraZeneca was going to cover us against the Delta variant. We knew other things, but that's also another discussion. But what I'm saying to you is, I wouldn't want to take the Sinovac myself, but other people might want to. And as I say, something's better than nothing, but it's not first prize.
Well, the concern there is if you do get that, then can you still get all of the others? It seems as though, or one of the others, so maybe you get it in the interim, but I don't really know what. I don't know.
We don't know. As I said, there's not enough out about the Sinovac to say whether you can boost it with a second vaccine or you have to have another Sinovac. We don't know that yet.
Okay, let's just move on to this other subject that for some reason it's probably the most aggressive conversation out there with regard to COVID-19, and that is the ivermectin discussion. I'm inundated with so-called proofs. I don't understand any of them, but either way, there seems to be a very aggressive and angry response to doctors or to South Africa not using ivermectin as far as its standard protocol is concerned. Let's just clear up a few things. Do you work for Big Pharma?
No.
Okay. Do you get a commission on the medication that you do use and prescribe? Okay.
Nope.
So, and would you like people to get better or not to come to your hospitals?
That's a definitive 100% yes. I would love people to get better.
So in other words, if there's something, and I want to go through some of the details, but I just want to be very clear that you have no other agenda other than to have people well.
100%. 150%.
Right. Now tell me about ivermectin. Your thoughts on ivermectin.
So let me put it to you according to the studies, and then according to you according to my personal experience.
Okay.
There's been many people that are saying that there have been randomized controlled trials and meta-analyses that have proven that ivermectin works. And I don't make these decisions on my own. This is a group of collaboration of ICU doctors, of professors, of specialists, of people who are on the front line who've looked at this data and have shown that studies have got no controls. They've got no blinding, no definition of disease severity. They're poorly defined outcome parameters. There are small numbers with poor randomization, wide confidence intervals, and widely varying comparator drugs. And they are not randomized controlled trials that can be believed. In fact, personally, on Thursday, I admitted 22 patients to the hospital with COVID-19. Of the 22, 14 were on ivermectin already. Now, they didn't start taking ivermectin the day they were admitted into hospital. They started taking ivermectin the day they got sick or when they were sick. So they were taking it for the long haul, for a few days already. Of those 14, 10 were in ICU and are critical at the moment. And of those 10, a few have passed away. So that's the numbers that we're dealing with. That's the reality we're dealing with. 14 out of 22 are already on this drug. Obviously, I'd love something to work, that we could have that magic bullet or that silver bullet or something to help us with this. But there's just no evidence currently to prove to us that this drug works. There are currently, however, randomized controlled trials being done in Oxford. There is the active trial. There is the recovery trial. That will hopefully give us some answers down the line to show whether or not there will be any benefit from this drug. Right now, there is no benefit. If there is benefit, we will definitely readdress it. We'll definitely change our stance. But right now, there is no role for ivermectin use in patients with COVID-19. The other problem with the ivermectin is also that all of these preparations of ivermectin that are being touted have got hundreds of other different types of medications in them, including antihistamines, antihypertensives. So none of them are 100% of the antiparasitic drug. They're all mixed with other things. So you just got to take that into understanding. Most of them.
Most, okay.
Yeah.
Another question that, or a point that somebody raised to me was, is it possible that if it was a pyramid, you're seeing the top part of that pyramid of people that are really, really ill? What about maybe there's a lot more people taking ivermectin that don't become that ill and that you don't see because you are seeing very ill patients?
No, look, it's a valid point, but you also got to understand the point. If they were taking it and they weren't very ill to start out with, it's more like it's obviously not helping. It's not doing anything. They would have got better anyway, because most of these people start out at the bottom of the pyramid taking the ivermectin. They're already taking it when they're not critically ill or they're at the bottom of the pyramid, and yet they're being admitted into hospital, into
in one
ICU,
day,
being ventilated.
14 out of 22 is a very high number.
It's a very high number, and it's a very scary number.
Is there any downside to it? Because that's the other argument, is that people are saying that it's not expensive and there's really no harm in it.
So there are downsides to it. First of all, as we've discussed before, it masks your inflammatory markers. So we look at something called a CRP and a PCT and the white cell count. And in a patient who's not feeling well, these almost look normal because ivermectins mask the levels to make them look normal. And it can delay you to starting corticosteroids, which is life-saving treatment in some of these patients. Some patients have recorded blindness. The other side of it, and that's a very small amount of people, but it is a side effect. Other people are now getting antihypertensives or antihistamines in their drugs, dropping their blood pressure, or having all other sort of side effects or sequelae of taking medication they shouldn't be taking in the first place.
All right. So that I hope we've answered it to some extent.
Look, I've got to say something. You always have people who are with it. You always have people against it. You need to choose who you follow and follow that person wisely. Especially make sure that that person is somebody who's dealing with COVID patients on a frontline basis every single day, and not somebody who's now just come up with some concoction of medication that they think will help people and are able to advertise things very well. So follow your leader well.
Yeah, I think so. But what's interesting is make a decision and follow it. You're not obligated to convince the world to do the same.
No, but the point is that I'm doing this for myself. I'm doing this for my family. I'm doing this for my friends. I'm doing this for people I care for. I'm doing this for my patients. It's not changing for anybody. No one's getting the medication from me. It's one line, and that's what we're doing. And that's what we're doing at our hospital. And that's what my colleagues are doing. And we're all following the same diatribe, which seems to be across the world. Yes, there are people who are using it, but once again, we disagree vehemently with it at this point.
All right, a couple of questions, and I hope already that we've answered a lot of the questions, because I did try and do that. I'm sorry about this. I'm a physiotherapist. Should I get a booster? Well, that is one we've already answered. Sorry, just going through a couple of. Somebody asking about Chile's bad experience with the Chinese vaccine.
Well, I think it's very similar to the fact with the Seychelles. The people have had bad experiences with it, and people have had major breakthrough infections, and we don't have enough knowledge about this, whether or not it is effective against the Delta variant or how it can help in other ways.
All right. Alex wanted to know the following question. He says, if we experiencing the Delta variant here in South Africa, and the vaccination period or pace is slow, is it possible that this will create or allow for yet another variant to develop?
It's very possible. We never expected the Delta variant to come here. Who would have thought that keeping your borders open and allowing people to travel here from India would have allowed the Delta variant to come here? We got caught with our eyes closed on that one, didn't we?
Yeah.
But the point is that there are going to be multiple mutations as we go along and multiple variations as we go along. And the only way to try and stop that is to vaccinate as many people as possible. If you look all overseas, if you look in Israel, if you look in America, they're still having multiple cases per day, but none of them are being hospitalized. None of them are dying. In other words, the cases are very mild and not severe and not needing to be in ICU and are not critical. So even if there is mutations, the body's making a neurological response and making the right type of antibodies to neutralize the virus.
Right. Maria asking just to please recap on the vitamins that we should be taking just to keep healthy.
So we're still using the vitamin D, we're still using zinc. We still say that you should take a general vitamin like neurobion or a thiamine and vitamin B sort of complex in it, niacin and nicotinamide, still that vitamin, and just a general well-balanced vitamin to keep you well.
If you're on antibiotics for another reason, can you still have the vaccine?
Great question. Now, you've got to ask yourself, if you are sick, and I'm going to just take that and sort of extrapolate it a bit, but if you're sick, let's say you've got a virus or you're coughing or you're short of breath or you've got some respiratory tract infection, should you be vaccinated at that stage? And the answer is no. And the reason is because we don't know if the vaccine itself becomes less effective when you've got some co-added infection. And that's why we're saying don't get vaccinated at that stage. If you're on, let's say, an antibiotic for a urinary tract infection, you've got no other sort of manifestations of any respiratory tract infections or sinusitis or upper airway disease, I don't see a reason why you can't. We're talking about people with respiratory infections or people with lung problems or issues at that stage that shouldn't be vaccinated whilst they are sick.
All right. And there was something I wanted to ask you here. If one has the first Pfizer vaccine, then got COVID, how long should you wait to have the second?
So we've got to now make it more of understanding. If you've had a Pfizer vaccine, you need 2 Pfizer vaccines in total. But if you've had COVID before you had the first Pfizer, or if you had COVID after you've had the first Pfizer, you don't need another booster because the COVID acts like a booster for the actual Pfizer. So you've got different types of antibodies from the COVID and from the Pfizer itself. So you don't necessarily need another Pfizer or a Johnson & Johnson. Same with the Johnson & Johnson. If you had Johnson & Johnson, you got COVID afterwards, you don't need a booster Pfizer at another stage. Right now, there's no need for third boosters for Pfizers. It might change at a later stage with different variants. And I'm sure on a yearly basis, we are going to be getting boosters. But if you've had COVID and you've got one vaccine, that's all you need for now.
Is it dangerous to go for the vaccination during the surge? A lot of people worried about this.
The danger is when you go to the surge, and what we've seen is people who are standing in the lines are speaking to each other, are on top of each other, and we find there's a definite transmission of virus in these queues. But if you do go for the vaccine, when you should go for the vaccine, wear a mask, wear a visor, don't touch your face, don't touch people, try and keep yourself as social distance from people as possible so you don't have to interact with other people.
All right. And we are running out of time. There's so many more questions. If you do want to send them in, please just write them below and we'll try and address as many of them as we can. I hope we got through most people's queries. The very, very specific ones we might not have been able to. Dr. Anton Meyberg, is there good news?
There's no good news. I mean, I'd love to say there's good news. I'd love to say there's some unicorn on the horizon or something to see, but
it's a nice day. It's a nice day.
We're still working. Well, not if you're cooped up in PPE for 5 hours, then it's not really a great day.
Yeah, I see the line on your, I see that line on your head. I'm assuming that's from your, do you think that's going to be permanent?
Well, I hope not. But the point is that we're done. We finished. We exhausted. We are broken. Our families are broken. You know, there's only so much more we can take. And just be careful. Just follow the rules. I beg and beseech you from the bottom of my heart, from every single healthcare worker that is out there, follow the rules. Get vaccinated if you can as soon as possible. We need this to end.
And on that note, we leave it. I'm Howard Feldman. This has been the Sunday Synthesis Podcast. I'm sorry we couldn't bring you better news, but it is what it is. Our job, our role is to provide as much information as we possibly can. Be safe, follow the protocols, and we'll chat to you next week. God bless.